Before we begin, can I ask one small favor? If you like the show and the conversations we're sharing, it would mean the world to me if you could subscribe to the show and follow along on whatever platform you're listening to this on. You may not know it, but by simply subscribing, you are helping us in a big way to continue creating and sharing our quiet conversations. Thank you so much. Now, onwards to the show.
There are 1 in 6 people in the UK with a serious health condition, and that is predicted to rise 37% of working age people, so not just the elderly, by 2042. The greatest obstacle is this misunderstanding of the relationship between mind and body. So this dichotomous idea that mind is inherently separate to the body. From this really interesting study in 1995, they found that it took on average 24% longer, so that's 9 days longer, for a little cut to heal in people that were chronically stressed compared to those that weren't chronically stressed. My work is using psychological therapies that are evidence-based to support people with health conditions and ongoing chronic illness symptoms.
This week on The Quiet Life, we're talking about nervous system regulation, what it means, how it works, and do we always need to be working towards down-regulation? To help me understand this, I'm speaking to Dr. Sula Windgassen, a leading health psychologist and a psychotherapist who uses psychology to improve chronic illness, chronic stress, and trauma. Dr. Sula explains the complex mind-body science in a way that can be implemented into daily life. After completing 5 degrees with 2 doctoral qualifications, including a PhD in psychological medicine, Dr. Sula has gone on to publish in leading academic journals, including the BMJ and the Lancet Gastroenterology. I'm so excited to share this conversation with you. Now onwards to the show. So what kind of psychologist are you?
Yeah, great question. So I'm a health psychologist, which most people probably haven't heard of. It's a particular kind of training pathway, and health psychology is a really broad area. There's some people that sit firmly in research and in preventative health sciences, so how to help people exercise more or stop smoking. My area of health psychology is using evidence-based psychology and psychotherapy to improve people's physical health outcomes.
So does that mean typically your clients, you see them in clinic, or are you out in the field?
Yeah, I see them predominantly in clinic, and people come to me for all sorts of things. So they might come to me because they're dealing with a chronic illness, or because they're experiencing burnout. Maybe people come to me because they're experiencing the after effects of trauma, and that's having a physical effect on their body, and that's why they want to see somebody that knows a bit about the mind-body connection. But generally speaking, I work on that intersection between how the mind and the body are related and have an effect on each other.
And I mean, I've followed your work for a long time, and what I really enjoy is the fact that you communicate very clearly both what things are and what things aren't, nuances in between. But even, I mean, for some people, as a psychologist or a psychotherapist, this idea of mind-body connection almost feels a little bit not removed, but kind of one step to the side. Where do those paths intersect or kind of differentiate?
Yeah, it's a really interesting question, because a lot of psychologists are trained still within a very biomedical framework where mental health is separate to physical health. And I guess that's the difference between a health psychologist, which is, constantly looking at how the two do intersect. But a lot of psychologists and therapists are trained in mental health models. So people coming to see them will receive treatment, which is based on models and theories that look to understand how and why somebody's experiencing a mental health difficulty, but it won't necessarily take into account how the physical experience of what's going on health-wise is impacting, but also how that mental health experience is impacting physiologically. So for me, really at the heart of the practice is that mind-body science, helping people understand that there is a big impact on our psychological experience, and that actually is broader than mental health. It's more than when we feel anxious or depressed, then we'll be impacted physically. It's, when we've taken too much on, or when, our family environment's driving us to distraction, that's going to have an impact physically on what's going on in the body.
Is that how you were originally trained, or was this an evolution, or was this a choice when you started all this?
So I did my undergrad psychology degree in Leeds University after doing a year of law, which I did not like at all. And I got really interested in the health psychology module that I was taught in one of the years. And that first introduced me to this idea that the mind and body are really, physiologically, quantifiably connected. But as probably so many people who do psychology are told how competitive psychology is. So I took a sidestep and went into marketing for a little while after my degree. And it was at that stage that my whole community of students disappeared from Leeds, went back to their respective towns or went to London. And I wasn't getting fulfillment from my job. And then I started having health difficulties. And there's a whole big story to this, but that's what my physical health experience really led me to then go and do a master's in health psychology. And after then I did a doctoral qualification in health psychology whilst doing a PhD in psychological medicine. And then from there I did further postdoctoral, postgraduate diploma in CBT. So that qualified me as a psychotherapist as well. So it was kind of strategic. There was a specific training pathway, but I always wanted to work clinically with people going through health issues to support them psychologically.
Right. And so it seems really fascinating because of kind of, I suppose, it's not a mixed background, but because of your different pathways into kind of the working with mental health or well-being. It kind of came to me really interesting when I was kind of looking through kind of some of your stuff online about this conversation, which we're going to have, because for me, I find it really interesting because the world these days talks about nervous system regulation. I mean, for me as a meditation teacher, breath work, it's a big aspect of what we do to help balance, to help re-regulate. But what I found really interesting in what you shared was the fact that it's not actually necessary, critical, or the end goal. Can you tell me more about that?
Yeah. I mean, there's such an explosion in this awareness of nervous system health and regulation, which I think is really great. But as with many trends on social media and short form content just broadly, there tends to be this dichotomy that it's all one way or it's all another way. So if regulation is good, then we always have to be regulated, 100%, and we should never be dysregulated. But if we think about what nervous system regulation is, it's allowing our autonomic nervous system, the automatic hardwiring within us, to become dysregulated because we need to get activated, for example, to do something, or because there is something stressful going on. We need to let it get up there so that we can activate and do what we need to do and problem solve, just as much as we need to allow it to, come back down and re-regulate. And if we're constantly trying to snuff out that top level, we're essentially suppressing, our physiology, but also our emotional experience. And we know that emotional suppression, for example, really isn't good for our health either. But we're also adding inadvertently a lot of stress, because every time you experience that upregulation because your fight or flight's kicking in, part of your brain is telling you that shouldn't be happening, you need to regulate, which is really stressful. And it adds this like meta layer of just, pointless additional pressure. We don't need more, when we're already stressed. And I think that kind of gets lost from this discourse on social media about needing to regulate the whole time.
Yeah, it's a fascinating dialogue because it is that psychological and social pressure that we should be something that we're not, or we are better if we're in a different state of it. But going back to what you were saying, when is it good to be upregulated? When is it good to be in the fight or flight? Like, what functions are necessary? Like, what actions need that state of us?
I mean, every single day we need to have that fight or flight kick in. Fight or flight doesn't always mean we're really, really anxious and panicky. It operates on this sliding scale, really. So, just waking up this morning, I will have had a shot of cortisol to help me wake up. That would theoretically be my fight or flight response, helping me wake up. And that's not just me, that's everybody. We all get that. If I am looking at my to-do list and I'm thinking about all the things that I need to schedule and arrange, and then, I'm looking at the schedule of when I need to leave the house. And, all of that will be impacting on what's going on in my sympathetic nervous system and allowing me to get the energy that is, that then makes me move quicker, for example. So there's lots of different things in our daily lives that just require our autonomic nervous system to be kind of going up and down, oscillating on this scale to different degrees. And then there's the bigger events that happen that, for example, if your dog careered towards the road, you would get that huge spike and you would hopefully yank back the lead. And your body does that without you having to think about it at all because of a healthy, responsive autonomic nervous system. And so when we're talking about trying to always regulate, it kind of gets as a way of trusting our bodies as well. It means that, we can't lean into these sometimes very uncomfortable physical experiences, but also very necessary in situations like that. Or, if you've ever been on a train and realized it's your stop and then suddenly you get that surge and you have to jump up out of your seat, These are all good examples.
Well, what is the role of this, like synthetic stimulus, like coffee or energy drinks? How does that impact?
So those kind of drinks are stimulants. And if we think about what's happening in the fight or flight, which is our sympathetic nervous system activating, so we're getting this shot of adrenaline, cortisol, epinephrine going through our blood system and circulation. And that means that it changes how our organs function, how our muscles function. Things like the stimulants like coffee, for example, or energy drinks, they have like an upregulating impact. So we get more adrenaline and we might then experience things like our heart beating faster. Lots of people, especially people who are very sensitive to coffee or caffeine, will experience like heart flutters or palpitations because of coffee. So then we've got this maybe agitation that can come on through the stimulants that we're taking in, and that's, interacting with what's going on in our nervous system.
And do you think things like coffee mask dysregulation or upregulation or a state of regulation as a byproduct of kind of how we are kind of in our natural state?
Yeah, it's an interesting question. I mean, I think there's so many things that can mask that, what we eat, what we drink, how we respond to things. So I introduce people to this concept of a nervous system thermometer chart. And on that is right at the bottom, we've got like this green area, an area of contentment. This is when our sympathetic nervous system, so fight or flight, is nicely balanced out with our parasympathetic nervous system, so our rest and digest. And the two are working like a seesaw. So when the fight or flight activates, at some point it needs to deactivate again, which usually involves our parasympathetic nervous system kind of coming up. And our body at a nice equilibrium, at homeostasis, is there. But when we have our sympathetic nervous system, we go in that activated mode, which is somewhere in the middle. So on my thermometer chart, that's red. At the bottom is green. And then at the top is deactivated mode, which is like purpley blue. And that's when we've kind of surpassed what our resources are for constantly being in the activated stage. And we've got nothing left, physiologically. And just thinking about this concept of masking, so that's where somebody might be in that activated stage, using lots of coffee to get through their day or, whatever it might be. And then their brain kind of like taps out. So you're experiencing slower thoughts, or it's going too quickly and you can't tether anything down, and your body starts to feel heavy. And you're then moving into this activated mode. So then you reach for your stimulants, whatever they may be, or other choices. And so that process is essentially masking, right? You're not aware that you've surpassed what your natural bodily resources are, and you're just kind of pushing through and keeping going. But what that does is it keeps us trapped in this ping pong between activated, deactivated, activated, deactivated. So we never really get that opportunity to come back down to homeostasis, or even it can make us feel really disconnected from things that get us back down to that content mood.
And is this why often fight or flight or the sympathetic nervous system or being in that state of it gets painted with the negative brush?
Yeah, absolutely. Because, our brains are calibrated towards threat detection. And there's so many threats in modern day society, whether it's like financial scarcity, health issues, relationship issues, the broader social environment at the moment where there's so much uncertainty. So if our brain's already calibrated towards threat, and then we've got all these social and environmental things going on, a lot of our experience in that activated mode is to try and fend off these perceived stresses and threats, as opposed to us being very present with things that get us into that mode because we enjoy them. In fact, I think as a society, we kind of massively underestimate the benefits of being intentionally activated, for enjoyment. And I see that a lot with people with panic disorder. Excitement and anxiety or panic are very similar physiological events in the body. And people can end up feeling excited, but that automatically gets encoded as a threatening experience, because physiologically what's happening is their body's being stimulated in a way that stimulates, being panicked, and then it ruins the experience. So, yeah, our brain kind of converts positive experiences of activation into threatening potentially.
It's interesting you say that. One of my teachers always says one of the main differences between excitement and anxiousness is the quality of how you breathe. And it's really interesting because what I like about what you're saying, and it's a big part of the work that many of us do in this field of understanding the nuances of bigger concepts, because it's very easy to say, well, we all need to look towards nervous system downregulation. We always need to look towards calming ourselves down, relaxing ourselves into quieter states. And yes, I think there's a huge necessary for that because of the state of upregulation or anxious tendencies that we have or stimuluses that we put in the body. But I do think, as you're saying, the need state to be in that fight or flight, when are those times that you think we can get a huge value out of being in a fight or flight?
Just as you're saying that, it reminds me that, I can't remember who talks about this, but I recently incorporated it into some materials that I was making about there being different ways that we can rest. So we often think about resting as, lying horizontal or doing nothing. Lots of people think, it's, sitting in front of the TV and switching off. I would argue that that's deactivation oftentimes, because a lot of times people aren't really being entertained by what they're watching either. They're sitting scrolling their phones as well, or they're, partially listening and flicking through a magazine or something else. So that really speaks to a passive experience because our brain's taxed, our body's taxed. When we're kind of in the deactivated state, probably what we need is upregulation, some kind of activation that can move us healthily towards that nice balance in the content mode. And so there, something as simple as going for a walk, getting outside, that will move you from that deactivated mode into a more activated mode. But that's a really healthy thing for you to do, as opposed to just completely switching off.
And are there different types of walks? Because there are. But you can think very easily that, yes, you're moving from deactivated into active state. So is that an upregulation with the intention of downregulation? Yeah. Like, how do you intertwine that, I suppose, in the language of what we're talking about, the value systems between up and down regulation?
So I think about it in terms of different types of rest. There's physical rest, which could be down-regulating. There's emotional rest, which again could be down-regulating. But then there's things like creative rest and cognitive rest, which actually that might be involving upregulation. So, for example, if I'm really angry about something, or if my boss has just yelled at me and, I couldn't really stand up for myself or what have you, physiologically, my body might be in this state of fight or flight. And if I'm saying down-regulate, need to get calm, that just might not match where I'm at and actually is quite suppressing. But if I go for a walk and I'm allowing myself to be upregulated, if you like, so I'm staying where I am on the nervous system chart, but it's just a different experience of that, kind of like, breathing differently. And it's allowing something to be channeled, expelled, but it's still using all the same circuitry, if you like. I think those are examples of where matching where you are already can guide you really to what your body needs. And sometimes that isn't going down, that's just staying where you are. But to give an example of where you might be needing to kind of move up the scale. So if I think that example of being horizontal, vegged out on the couch, you can't, in fact, lots of people tell me this mode of like, I know I should go for a walk, but it's not going to be good. It's raining. I'm going to feel worse. I'll be exhausted afterwards. Or I would like to see my friends, but I'm not going to I'm not going to have a good time because my mood's low and what have you. In those example moments, what I'm encouraging them to do is to actually go and activate, to go see the person, have that conversation, go out for that walk, see what it's like being in the rain, and allowing your body to kind of push yourself up, down that scale, because then you're kind of moving yourself from this frozen state to this more, activated state, working with your autonomic nervous system, but to work to improve your mental experience as well as physical experience.
And then how do you draw the line then about knowing when to move towards activation for the benefit of your well-being versus moving past the line that leads you into burnout or exhaustion or inability to process?
It's a really good question. To be honest, I think it starts with getting familiar with your nervous system and your broader experience around that the concept of that nervous system thermometer chart is to help people do that. And what I draw out for them initially is the kinds of thoughts you'll be experiencing in the different modes. I mean, there's a whole host. There's not just one kind. You can experience like lots of positive thoughts in activated mode as well as, difficult ones, the kind of emotional experiences you'll be feeling, the kind of physical experiences. But only you know what your different modes look like. That can be very different across individuals. But when you start to look at what you're doing in a day and how your body feels and how you feel emotionally and what your mental landscape looks like, then you can start to really match that to what you need and become a bit more cognizant of, actually, this is probably me pushing myself too far. But experience is the best way, because you can reflect back and be like, oh yeah, actually, I think that was a little bit too much there. And that's okay, And
is there ways that we can get familiar with our nervous system on our own, or is it only something that can be done with specialists?
Notice the moment where you've been stressed, bring that up to memory, and then observe what happens in your body, observe what happens emotionally, and then look out for that replicating across the week, but also look out for, across the week, what it looks like to perhaps be deactivated. I think the thing that people find most tricky is working out if they're deactivated versus in that safe and content mode, because they can look externally really similar. So if you're sat reading a book, that looks exactly the same when you're deactivated versus in your safe and content mode. But one, your mind might be racing and you're rereading the page over and over again, and you're thinking about all the things you have to do and feeling guilty for not doing them, but unable to do anything else. In the other, you're, engrossed in the book, very present and enjoying it and feeling nourishment from that book. So getting familiar with that internal landscape across all of those dimensions, not just the mental landscape, but physically as well, helps you to look at your day-to-day through a different lens, I think.
Is stress a personal perception, or is there clinical markers for it?
A bit of both. So there's definitely clinical markers. We've got loads of different biomarkers of stress, levels of cortisol. Maybe this is even a step further, but we know that stress interacts with the immune system, for example. So we can see that chronically stressed people have changes in how their immune system is functioning, levels of inflammatory markers. Again, it's kind of a secondary step from being chronically stressed. Galvanic skin response when you're acutely stressed, heart rate variability. Those are all the very acute markers, and then they could have an impact on secondary indicators of chronic stress. So there's a definite physiological experience of stress that's measurable, but one person's stressor won't be another person's stressor necessarily. So that's the difference. It's what our brains and what our prior experiences have, socialized us to whether we experience them as stressful or not stressful. You know, my husband will leave for a flight with like an hour to spare and think nothing of it. Meanwhile, I'm freaking out. But yeah, equally, you know, there's things that will stress him out that don't stress me out at all, like leaving cupboard doors open.
I think everyone has their different things that stress them out, but I think it is really interesting that, you know, that perception of stress is obviously unique to everyone, but the fact that there are elements that we all experience through heart rate, through how we are, through the markers that we can kind of be assessed on, I think it's really interesting. And going back to the thing we were talking about, the nervous system and the value, I suppose, of having that upregulation or that fight or flight, what is good? Like, what is good now? Where should we be in this thermometer or in this spectrum of our nervous system regulation, up, down, left, right?
The goal, I think, is responsive and flexible nervous system as opposed to where we need to be any particular period of time. So if your nervous system can allow you to go up and down, you know, within seconds, minutes, then it's a nice, healthy, functioning nervous system, as long as you can get back to an equilibrium. Whereas if you're stuck in any one state for too long, and it's very hard to get back to what we call homeostasis, so basically that bit at the bottom, then that's when we kind of would be saying that's probably quite unhealthy, and there needs to be some intentional work on regulating and working. But I think if we move away from this idea of needing to be regulated and move more towards having that responsive, healthy nervous system that you can trust to do what it needs to do, and you give it the environment to do that, which means, you know, sometimes minimizing stresses, but sometimes we can't do that. So then it's giving yourself opportunity to process whatever's been stressful.
Hi friends, I hope you're enjoying listening to the show. One of the ways that we can keep this pod going in the best possible way is by the help of some of our amazing partners and friends. So if you can give me just a few moments to listen into these ads and messages, it would be so appreciated. Exhale is a choice to take control of your mind and mental health. Welcome to the Just Breathe course for breathwork and meditation, our 6-week program to help you breathe better, reduce stress, and regulate the nervous system. Hi, I'm Michael James Wong, meditation and breathwork teacher and founder of Just Breathe. And my life's work is dedicated to helping as many people as possible quiet the mind using the power of breathwork and meditation. And that's why I created Exhale. This course brings together my 20 years of experience studying, sharing, and teaching these practices in the real world. Inside the course, you'll gain instant on-demand access to over 100 plus videos, lectures, technique tutorials, and guided breathwork and meditation practices dedicated to helping you create a personal and powerful ability to respond to any and all of life's big and small stressful moments. In this course, you'll learn my unique perspective and agnostic approach to help quiet the mind and regulate the nervous system. Each week during the course, you'll be invited to join our live Zoom sessions where I'll share and discuss with you both the science and the wisdom of these quiet practices. And even more, I'll be joined by some of the world's most well-respected psychologists and neuroscientists to help us understand even further. We'll talk about the nuances of stress, the science of stimulation and how we regulate the nervous system, and how to rewire your brain for the better. And what I love most about this course is you're not just joining me, you're joining a community of like-minded people all around the world who are dedicated to learning more, building their personal practice, and understanding how to use breathwork and meditation to change our lives for the better every single day. As a reminder, you'll get on-demand and lifetime access to the course material. You'll have access to 100 plus video lectures, techniques, and practices. And you'll have 6 weeks of live talks and lectures and learnings with me on breathwork and meditation. You'll have 3 amazing talks with some of the world's most well-respected psychologists and neuroscientists, and you'll become part of our global Just Breathe community. So join us on the journey as we take control of our mind and mental health. Welcome to Exhale. The course is now open. See you on the inside. You often hear a lot of people who are highly stressed, or they feel like they're always in this sympathetic response. They're always at a peak state of being on the edge of exhaustion or burnout. But what about the other end of the spectrum? I suppose the bottom out, where people don't have a stress response, or maybe not a stress response, but they They don't. It's really funny. I was looking like all things. You look at stuff on the internet, and I think there was this one thing that was posted that it was said something along the lines of, and I'm paraphrasing, I either have a really good stress response or I'm just disconnected with everything. What are your thoughts on that?
So that's what I would conceptualize as that deactivated mode, but when someone's stuck there. So that deactivated mode is really protective to us. So an example is if you've ever experienced grief, totally emotionally overwhelming. If you were to constantly be stuck in grief and the full kind of emotional experience of that all of the time, it would just be unbearable. So our brain, our nervous system does some stuff so that we can numb out. But it's not just in grief or big traumas. It does this for us all of the time. And so there's this model that was proposed, I think it was in the 80s, but since then there's been lots of research and work done on it, called allostatic load by a guy called McEwen. And he proposed that there's different ways that our body starts to respond to chronic stress. So it can have this exaggerated response where it's kind of, constantly looking out for it and reacting to it. It sees it everywhere. So we keep going in that activated mode. Even, there might be a slight bang outside and then suddenly it jumps up there and then somebody moves their chair over there and then it jumps up and then you say something and my mind goes somewhere and it jumps up, so we've got this really reactive nervous system response that has been trained to do that because it's so used to all of these stresses. But the other one is, to your point, this one where I think it's called inadequate response. So it's where the nervous system's been overactivated for so long and then we've basically burnt our capacity out. So everything just downregulates and we're stuck there. So then, that fight or flight response just doesn't happen. The bang goes off, barely hear it. Somebody says something horrible to me, barely respond. And psychologically what that feels like is disconnected, numb, don't care. And it's really tricky because there is a very protective element to that. You don't have to be bothered by lots of things that are really bothering, but it's not good for your health either because on a physiological level, your body's not responding in the way it needs to.
Where does empathy sit on that scale?
So there was a really interesting set of studies that looked at empathy and it looked at compassion. And it was in collaboration with this guy called Matthew Ricard, who's a monk, and he does a lot of mindfulness. Yeah. Do you know him?
Yeah, I know who he is.
Yeah.
Don't know him.
He does a lot of neuroscience research on meditation and mindfulness. And they'd got him in to do this study because they wanted to see what happens when you practice empathy, when you practice compassion. And so they were like, yeah, go in the MRI, the functional MRI, and now be compassionate and think of suffering of somebody or other and now practice compassion. And they pulled him out and they were like, what are you doing? It's like, I'm practicing compassion. They were like, well, your brain's not doing what other people's brains do when they practice compassion. And he was like, oh. So they talked about the concept and they were like, oh, that's something slightly different. So do this instead. And what they were telling him to do was think about the kind of suffering of others and, really send sympathy and imagine what it's like to be them. So he did that. And his physiological markers went wild. You could see it represented in different brain areas, but also physiologically and psychologically, he was like, I had to stop, which he'd never had to do before. And so then when they got him back in, they were like, now do the compassion thing that you were doing. And so he did, and he felt much better, and the brain areas changed. So the conclusions from this, and I think it's been replicated in different ways, is that empathy and compassion are different entities. Empathy can allow compassion, but empathy on its own without compassion kind of sticks you with this state of suffering because you're just really suffering with someone. You're thinking about how awful that is and your emotions change because of that. And that then has a physiological response. Whereas compassion is more sending love and connection towards that person. So it's a much more positive emotional experience. And there's a sense of, I want to be able to help them, but you're not getting stuck on that, oh, but I can't. And the hopelessness that comes with that is just a, pure feeling of connection. So, I guess what that research really highlighted to me is empathy can really burn us out. So it really should be called empathy fatigue is his conclusion. And I agree, as opposed to compassion fatigue, which is actually quite replenishing.
That's fascinating. I've actually seen a few photos of him dressed as a monk with all the probes that are all on his head.
Yeah.
And it's a really fascinating study. And it just kind of goes to show that how much of an impact empathy or highly sensitive people have in the world or when they're functioning or out into the world. What is biopsychosocial model of well-being?
So this is a really old model. In the 70s it was proposed by a psychiatrist who was training in a psychiatric unit, but he kept seeing this overlap between psychiatric conditions and physical health problems, and he was making the link between, well, essentially the mind-body connection, how the two impact each other, but also the social environment, which was and still is very biomedical. So people were being seen as the sum of their parts. So physiologically, there's a chemical imbalance. So we just need to change that. You're now having a surgery, and that's obviously going to have an impact mentally, but the two are treated very separately, and there's no cohesion, and that was having a negative impact on outcomes. So he proposed this biopsychosocial model, which is essentially that our biology impacts and is impacted by our social environment and also our psychological experience. So if you imagine like a Venn diagram, in the middle is the overlap between those three spheres. So, it stands to reason if I have multiple sclerosis, that's going to impact on my psychological experience. I might change what I'm thinking I can do for the future, or how my relationships are. I might have lots of worries about that and feel anxious. But equally, how stressed I am and how preoccupied I am with the symptoms is going to feed back into the symptoms I experience, because the nervous system becomes more responsive if every symptom that I'm experiencing feels like a threat and an indication that I'm relapsing. And then my social environment on top of that, if the doctors have been very reassuring, this can be managed, here are the medications if anything goes wrong, or, you get any changes in symptom, you come back and you'll get some support. I'm going to feel much more reassured than if they're like, yeah, try that out, I'm sure it'll be fine. You can make an appointment and you'll see us in 2 years, Then I'm going to feel much more unsafe, and that's going to impact on all of those things.
And is that usually a model that is led from a physical, like does it usually start with a physical, like you broke your leg and the impact is here, or is it something that we can come in at in all directions?
All directions. I think that's the beauty of the model, that it's bi-directional and these things are constantly interacting. It's not necessarily about causality either. It's just a framework to understand how health, but also mental health, works and is affected. And ideally, it should inform policy, social policy, health policy, how people are treated in the healthcare system, what protocols look like. Unfortunately, it's not. So we're still very much, under a biomedical system where a person is divided up into their parts, neurology over there, gastroenterology over there, gynecology over there, not seeing how these organs have an impact on each other, much less how your psychological experience has an impact on all of those things.
Would you be able to share maybe like an anecdote from a client, obviously anonymously, how this actually works in real time?
Yeah. So a really good example is, let's take irritable bowel syndrome. So somebody might have an experience of like food poisoning, and that disrupts their gut function, and they have terrible symptoms for a while. They have to take some time off work. So that's the biological thing that kicks things off.
That's usually the thing that shows up first?
Can be. In this situation it is.
Okay.
Not always, though. So when they get this food poisoning, let's say, so there's a particular bug that's made these symptoms, they've had to take time off. So if we flip over to the social sphere, they are taking time off work, and that might impact them financially. It might impact, their relationship with their boss or their colleagues, their progression opportunities, depending on what the workplace is like. And so then if we look at the intersection between that and the psychological experience, rather than, okay, I'm ill and I just need to take time off, their mind's racing about all the things they're missing out on, what their boss is thinking of them, and when are they going to get better. They're really putting emphasis on this. That means that they might end up pushing themselves before they're actually healthily ready. So then their autonomic nervous system, which now is impacting back on the biology of things, is activated and kind of pushing beyond its capacity, which impacts the gut function again and the immune system function. So their healing prognosis lengthens out because of the kind of psychosocial impact, as it were. So what initially started perhaps as a specific biological event, the ripple effect on the psychosocial then feeds back into the biological.
Do you find that there is a lot of support from traditional medicine as this modality or methodology of well-being, or is it something that is still a little bit at odds?
No, I don't think there is, because if there was, there would be an integration. Ideally, there would be these multidisciplinary teams where psychology is included and other allied health professionals, so dietitians, physios, nurses, as well as doctors, whoever else needs to be involved. That does exist for some health conditions in some NHS trusts. But as we know, the healthcare system's stretched, so it moves away from that more and more and more. If we were truly biopsychosocial, then we would have input from all the different teams. So when somebody comes to my clinic, for example, often they come to me at the end of the line. They're like, I've tried all of the medical stuff, it's not working. So I'll try you now. But even then, I want to assess, have you seen, let's say somebody comes to me with chronic urinary tract infections, kind of patient I see a lot. I want to see, what has the medical intervention been? Would they consider maybe using different antibiotic protocols that can be complementary alongside what we're doing? Or somebody with ongoing pelvic pain, have you seen a physiotherapist? Would you be willing to see that? And again, that physiological support can really complement alongside the psychological that we're working on. So as best I can, as my kind of singular unit in a clinical health psychology practice, I want to try and pull in. It's not, and I think that's a real good distinction there, is that it's not psychological is the route to improving things biopsychosocially. It's just one aspect, one avenue in.
So in a perfect world, you would be at the beginning of the healing process.
Yeah, ideally.
So when you were saying about asking a patient or a client if they'd be willing to change their antibacterial protocol, does that literally mean you can change the prescription?
No, it just means that I can review options with people that I refer to or, have referred to me. So, to go back to that example, there's lots of different ways to treat chronic urinary tract infections. For some people, they'll go on intermittent protocol of antibiotics. For some people, they'll go on like a longer term one. And so it's important, and that's the other aspect of the biopsychosocial approach. It's important that whatever you're doing, you're bought into. If somebody is not kind of convinced that something's going to work, that also is going to impact the trajectory of that treatment. So as comprehensive as we can make it, the better.
What if the pathway is slightly different? So obviously if someone's experiencing exhaustion, burnout, high elevated stress, and potentially they don't, let's say, go to the doctor, but they come see a psychologist first, how does the biopsychosocial model play out in that sense?
Yeah. So, well, first of all, lots of people come see me for burnout because of a physical symptom. They're fatigued all of the time, or they're always getting headaches, or their immune system's shot, so they're always getting, colds.
Does burnout have non-physical symptoms?
It's a good question. And yes, emotionally, people are just like, I'm not motivated. I can't get my brain to work. I've got no passion for my work anymore. So that is a part of burnout, definitely a big part of burnout. say they come to see me and they're like, I'm burnt out and I can't go back to my job whilst I'm like this, but I need to get back into it. If they've got that conceptualization that they're burnt out, they're already acknowledging part of that biopsychosocial model. Then they're noting that social environmental experience had an impact on their psychological experience, which then impacted them physiologically, because now their kind of whole balance of everything has changed, which might be manifesting emotionally or physiologically or both. So just having that conceptualization, I think, is really important. And then where people get stuck is they've got their particular goal or direction where they want to get back to. So let's say, somebody's emotionally burnt out and they're not experiencing physical symptoms, but they're like, I just want to feel motivated and to be able to do a good job and have the kind of brain capacity like I used to. In the meantime, they're kind of completely withdrawn and their, self-care is minimal. So they're eating irregularly, their movement is maybe non-existent, or they're moving loads, and that's the only way that they're channeling their stress, so it can go in either direction. We want to look at what's going on physiologically for somebody via their behavior, first of all. So, what's your access to outdoors? What's your access to movement and things that allow you to get your body activated? What's the, your physiological nourishment looking like? Are you just eating beige meals and like once a day, or are you getting your nutrients? So that's like a first foundation, which really focus on the more biological aspect, which absolutely needs to be addressed before we could work on, okay, let's work with the complex, cognitive inbuilt rules and assumptions and belief systems that have contributed to you working so hard beyond your means.
So if anyone's feeling in that red or purple, they're feeling in this state of moving towards stress or exhaustion or burnout, they're feeling like there's a lot of overwhelm, are there things that you kind of prescribe as a catch-all, kind of here's protocol 1, 2, 3 that will work with, or is it literally unique to the person?
Generally, well, when I'm working one-to-one, it's definitely unique to the person. So we do a thorough assessment to see, all the different things that will have contributed to this starting and to, it continuing. And that's going to be dependent on their personality, their preferences, their coping resources, their support network, and what have you. But there are definite principles that, are there for everybody. And, first and foremost are more the behavioral things. What are the sort of things that you can do to nourish yourself? And that might be starting with the very basics, like I say, just making sure you're eating regularly, making sure you're getting out of the house. But also within that is, within that foundational is connecting with other people. When we're vulnerable, our go-to is to withdraw and to become more isolated. And I think a lot of us have this inbuilt thing of, I can't share my problem until it's partially fixed. But for whatever reason, that seems to be a really, really common way that we deal with things. So what that means is we become more isolated when we're more vulnerable. And we know that isolation massively has an impact on mental health outcomes, mood, well-being, but also physical health outcomes. So in the initial stages, what I'm trying to get people to do as well is connect with their network, or just deepen or enhance their existing relationships so that they can ask for help, or that they can have more of a nice time with somebody. So often it's not even about asking for help. It's just about get playful again with people without any of these big expectations. And once you've got that foundational level of, self-care, self-nourishment, if that's dropped off the map, then it's, getting familiar with the nervous system and how that plays out based on what you're doing and tweaking accordingly. So there's a principle that I think applies to absolutely everybody, which is probably one that you're very familiar with, which is savoring. So what I love about savoring, which is really just the present moment, intentional awareness of something that gives you satisfaction or pleasure or comfort or joy, is that you don't have to be with that for an hour, 20 minutes, 10 minutes. It can be like a snapshot of 30 seconds where you're like, oh, that felt good. And if you're, intentionally seeking out moments to savor, even if that's getting into bed at the end of the day and enjoying how comfortable it is to be in there, or stroking your pet or having your morning cup of coffee, it literally changes how your brain is working. It starts to recalibrate it from this threat detecting machine to, oh, actually there are times of joy, and it moves it up to a more neutral stance. So I think that's something that absolutely everybody could, start with straight away.
Similar to what you're talking about, savoring it, it's moments of real connection. But in order to do that, to have moments of real connection, you have to have intention plus attention. And without it, we don't have the capacity to be present, to be aware, to be in a connected space, because good intention only goes so far.
Yeah.
Whereas real attention, or the capacity to focus, is the hardest aspect for the human brain or mind these days. So it's a really fascinating thing. And it's just nice to hear it from the other side of it. Whereas my conversation always comes from, let's call it the wisdom model, as opposed to the wisdom brain, as opposed from the intellectual brain, which I think is a fascinating intersection. Sula, this is a really fascinating conversation. I want to thank you so much for your time, for all of your insights, and for reframing the need to know that it's not all about nervous system regulation. If people listening were to take away one point from all of this, what would it be?
I guess it would be, if you're having a difficulty, rather than looking at it as a unitary thing, try and dissect it into three. The causes socially, psychologically, physiologically, but also the kind of maintaining factors that are social, psychological, and biological, and see within those different spheres what's within your remit of control that you can influence, because you only need one tiny corner to make a big ripple effect across all of them.
Based on your line of work or your perspective on well-being, how do you define a quiet life?
Quiet life is one that is aligned to your values, I think. One that allows you to have quiet moments, but also to peacefully enjoy your moments of activation.
If people listening are interested to find you, connect with you, where's the best place?
I think that would be my Instagram, which is _health_psychologist_ all the underscores.
Thanks everyone for listening. We'll see you next time.